Hello guys, so we are going to talk about a local practice theory called the Theory of Nursing Practice and Career by Cecilia M. Laurente. But first, I am Renee de Vallesteros, a first-year nursing student, and let's tackle now the topic that I will be presenting. So, who is Cecilia M. Laurente? Well, Laurente is a Filipino nursing theorist who focuses her works primarily on helping a patient through support systems, specifically the family. She published a paper entitled Categorization of Nursing Activities as Observed in Medical Surgical Ward Units in Selected Government and Private Hospitals in Metro Manila in 1987. As we go to her theory of nursing practice and career, well, the theory was from her study, the categorization of nursing activities as observed in medical surgical ward units in selected government and private hospitals in Metro Manila, which was conducted from January to June 1987. In the study of Laurente, she states that the other entry point for helping the patient is through the family, when nurses can be great assistance to prevent serious complications. So she emphasized the effective communication can be championed using the family as an entry point to help a patient. Lastly, the nurse can help strengthen the family's terms of knowledge, skills, and attitude through effective communication, employed informative, psychotherapeutic, modeling, behavioral, cognitive behavioral, and/or hypnotic techniques are summarized and evaluated. In her basic assumptions and concepts of the theory, we have the anxiety, which is a mental state of fear or nervousness about what might happen, or it is a feeling of worry or unease about something with an uncertain outcome. So we have three nursing caring behaviors that affects the patient's anxiety. So the first one is the presence. It is a person-to-person contact between the client and the nurses. It conveys relational and support messages, and it reinforces security and warmth in relationship. Then secondly, we have the concern, which is development in the time through mutual trust between the nurse and the patient. It also reflects that the nurse views client as person with feelings and dignity. So concern for the patient is founded on the reverence for life, love of self and others. Then lastly, the stimulation, which nurse stimulation through words stops the powerful energy resources of person for healing. There are expressions of confidence in clients' ability to mobilize their own resources of energy to regain sense of control and active participation towards recovery. Moving on to the next slide, we have here the enhancing and predisposing factors. So predisposing factors are defined in these models as factors that exert their effects prior to a behavior occurring by increasing or decreasing a person or population's motivation to undertake that particular behavior. So in enhancing factors, we have one's caring experience, beliefs and attitude, feeling good about work, learning, caring at school, what patients tell about the nurse, coping mechanism to problems encountered, and communication. While in predisposing factors, these are age, sex, civil status, educational status, length of work, and experience. So here is a video that correlates with the theory and it provides an idea and knowledge. As we watch the video of applying Laurente's theory, you will learn nurses' behaviors that affects patients with anxiety and how relieving those anxiety using our caring behaviors will definitely help the patients. So the first thing that the nurse did was to do early roundings, letting the patients or family members knowing that you will be checking in with them or rounding on them every hour to make sure everything is okay is a must, because it prevents and reduces the worry that can occur to patients. Secondly, let your patients be heard. When dealing with anxious patients, the most important skill is to learn to listen, because most of the patients want to know that you are listening and interested in their concerns. This will convey respect for their self-knowledge and also build trust with one another. The next one is to explain the what and the why, since the majority of the patients with anxiety tend to overthink and they do have the right to know the information such as the hospital routines and procedures to keep them updated on happenings. Lastly, don't tell your patients to relax but show them how, because some patients will be able to tell you what they need, and if they can, then help them with some relaxation techniques and make them as comfortable as possible. These behaviors will help to decrease the patient's anxiety by applying the theoretical model in order to achieve the result. Combining and applying the predisposing and enhancing factors to make the nurse's care behaviors, the presence, the concern, and the stimulation associated with another, aiming to decrease or reduce the anxiety of a patient. Research found that communication gaps between patients and caregivers can occur when hospitals do not address the issues that patients' thoughts are most important. And that is all for the theory of nursing practice and career by Cecilia Laurente. Thank you for listening and stay safe, guys.